We're talking about MDs and NBs. We're talking about the medical establishment and how it may or may not be serving our non-binary folks. So let's begin, Diana, by talking about those two little check boxes, the male and the female. I have to imagine that our current healthcare setup can be pretty invalidating for NB folks. What can you tell us?
It's really frustrating as a non-binary person to walk in and try to get healthcare when you are restricted to one of two sets. And everything ends up being dehumanizing because you have to either spend your time constantly being misgendered or constantly correcting people. For example, when I had an unfortunate incident and had to go to the ER last year, I was constantly being gendered as she and called ma'am and doing all these things because I'm marked as female in my medical records because I was assigned female at birth, even though I'm non binary. And at that time, it was just this dehumanization level that was on top of me already having an emergent healthcare problem. And so it ends up restricting your willingness to go into the doctor because you know it's going to be a battle. It ends up being a problem for communicating exactly what your healthcare needs are because people make a lot of assumptions based on those boxes. And it's dehumanizing just simply on a linguistic level because I will get emails about, it's time to come in for your well woman visit. And I'm like, I'm not a woman. It's not a well woman visit if I'm not a woman. So
doesn't apply.
Yeah.
Sure. Well, in my limited experience working in corporate healthcare, in that setting, even people who are clinicians, nurses, psychiatrists, doctors, I mean, everybody in that setting, even the folks that were eager to respect gender identities, were kind of hamstrung by that very two box system. And even a lot of the so-called accommodations that we would make for trans folks were incredibly dehumanizing. What kinds of stories can you tell us? What have you seen?
Yeah, you have to, if you want, if you're non-binary, there's not a spot for them to put that on your sheet. So they have to make special notes of this person uses they, them, or this person has this specific need. And not everyone who you see in a doctor's visit is going to read those notes. So I walked in earlier this summer for a consult with a surgeon talking about top surgery, and the clerk at the desk greeted me as ma'am. And I was like, you are working in a clinic that services genderqueer people. Training is a thing. And also it's very often in how people, when you're doing establishing care things where you're filling out forms, how they choose to represent the boxes too can make a difference, because some cis people have written new forms to try and be inclusive, but they end up with man, woman, trans or something like that. And you're like,
right.
And that was really what I saw working in a hospital where it was generally two people to a room, and generally you were housed with somebody of your gender. But if somebody was trans, then they just got their own room. And we would certain employees would put effort and intention behind using correct pronouns, behind using correct names and these different things. But every single form still had a legal name. It still had a assigned at birth gender and all of these things stamped on it. And it was incredibly alienating for folks that were looking to heal.
Yeah. It's also very hard, especially if you have started going by a new name but haven't updated it in your medical records yet, because that's part of how they confirm that you are who you are.
Sure.
Is by asking for your legal name. So they come in and they're constantly dead naming you all the time because they have to.
Often in front of people that you wouldn't necessarily share that information with.
So it ends up being very frustrating just to navigate a basic doctor's visit.
Yeah.
What
Well,
what field? I'm sorry, Christy. What
Mhm.
if you could choose one field or one box to add to those forms? What would it be?
Ooh, that's a good question. I would, instead of having the gender section be a checkbox thing,
Mm-hmm.
just a line where I can write in non-binary
Sure.
trans mask, something
Brilliant.
like that.
That is a
And so,
great answer to my great question. Thank you, Dianna.
Yeah, I mean, well, and it highlights something else here that we so often have this kind of conceptualization that is like male, female, and other. I
mhm,
feel
Yeah.
like whether we're talking
Yeah.
about people who are binary trans, that are not the gender that they were assigned at birth, but that do fit into a male or female category,
mhm,
or whether we're talking about somebody who is more gender fluid, or specifically in this conversation about folks who are non-binary, we just don't see people's gender in any sort of sincere way. It's sort of like
mhm.
male, female, and okay, asterisk. And
Yeah,
so for that reason, I have to assume that there are a lot of barriers to accessing things like HRT or other gender affirming care when somebody is non-binary and doesn't want to fall into the opposite sex, if I can use that term, or somebody who
yeah,
is trans but binary.
yeah. There's a lot of our current system of trans healthcare that basically posits that transition has an end point and that you are going from being this to being this other completely opposite thing. And so it assumes that you will be taking HRT, that you'll be wanting these surgeries, that you'll be doing this. And thankfully, we've been moving away from that model, especially in like more progressive areas like where I live. But it's still, even like for doctors who are progressive on these things, they still have these requirements and regulations that they have to follow. So for non-binary people who, like me, don't really want to take HRT, that means some aspects of surgical transition will be cut off for me.
Mm.
I can't do that unless I am on HRT for a number
Because
of
you're not on
years.
the transition escalator, if I
Yeah,
can use that
apparently.
term.
Yeah. So it's one of those things where I can't. I would love to be able to like pick and choose what parts of my care I wanted, because that's part of what being non-binary is, and stuff. But because of the requirements and regulations, which are often written by cis people who have, if they've spoken to trans people, they've spoken to binary trans people,
Hmm.
and so very often the system that's set up is to make sure that when a person transitions, they pass as the other gender. That's got a really long history in trans healthcare, and it's one of the ways in which non-binary people who don't want to pass as like, I don't want to pass as a man, I don't want to pass as a woman, I want people to look at me and go, what? so so that's part of the thing, is that there's no healthcare like path for that,
Hmm.
because it's built so much on that binary model.
Well, I know that statistics around trans issues are few and far between and basically non existent when we're particularly talking about non binary folks. But what can you tell us
Mhm.
about the scope of these issues?
Yeah, we don't have good stats on how many trans people there are in the US, partly because there are a lot of questions of how to count us in the census.
Hmm.
It's not because like some binary trans people who like got their surgeries in their 80s and stuff and has been living as their gender for decades and stuff will just tick box whatever gender they identify with on the census and things like that. So they end up being grouped back into cis, and we don't have a way to identify really non-binary or trans in any of those. So we don't have a lot of good data on it. I went looking for for data on healthcare systems and stuff, and we don't, like in the US or in the UK or in Canada, we don't have really good publication on those, because for one, we didn't actually start studying it until like within the last decade, and
Hmm.
two,
Mm.
the studies that existed before then were extremely flawed. So as far as I know, we don't have numbers, but we do know from surveys of like Gen Z that like of the group of Gen Z that identifies as LGBT, 25% of them identify as non-binary. So we know that it's a big category.
Yeah, that I mean, that's
Yeah.
definitely a larger discussion and certainly a confusing one that we as a culture and as a society are still working to wrap our head around.
Mhm.
But I think it's really fascinating to see the generational shifts and how, as we make these identities less expensive socially to glob onto or to connect
Mhm.
with, how they become much more common. And
Yeah.
it's fascinating to think about how, at the end of my lifetime, these things may be not just normalized, but much more common simply because there's so many fewer barriers to actually
Mhm.
acknowledging them. This is one of those barriers that we need to figure out in order for our kids to have the opportunity to feel safe being themselves.
Yeah, exactly. I want my niece in South Dakota, like if she's my oldest niece is 10 right now, but if she gets to be like 15, 16 and comes out as non-binary or whatever, I want her to have access to the same care that I do just across the border in Minnesota.
Mm-hmm.
And I know because of the governments of those two states, it's not the same.
Yeah, well, so
So
what is some of the impact here? If we don't have particular numbers, what kinds of problems are these policies or just these systems causing?
you end up with a lot of people slipping through the cracks because there aren't like in South Dakota, there's not really a whole lot of great trans care and stuff. And because of that, people don't go to the doctor because of how they'll be treated. They don't seek a lot of things for like basic medical problems that could be resolved quickly and stuff because of that mistreatment. And it ends up causing a lot of trans people to fall into medical debt, to have to self manage their own HRT, which can be dangerous. There are
Mm,
safe ways to do it. And I encourage, like, if that's what's available to you, to do all the research you can on it and stuff. But it ends up with trans people just sort of having to cobble together what we might have available and what we have to figure out for ourselves. And that
yeah.
can cause a lot of problems in terms
No,
of like expenses, trips to the ER, things like that. So,
yeah, I've definitely
mhm.
seen that just in my small little porthole into this world as a therapist, talking to folks who are impacted by all of this. I have worked with so many people that feel incredibly uncomfortable having even
Mhm.
the most basic conversation with their doctor. And honestly, I work with a lot of trans or NB youth that frankly have at this point like earned an associate's in
Mhm.
hospital management because of all of the effort that they've had to
Yeah.
go through to self-advocate and to understand.
They're I kind of see what Christy was going on, is that trans people are
Mhm.
forced to be the autodidacts of their own medical care, which is
Mhm.
kind of and one thing I wanted to say too was, I mean, I have an even smaller porthole than Christy does as a cis man, not a
Mhm.
straight cis man, but a cis man. Is that normalization really is so important to this issue, right? When people can feel comfortable with the with the line instead of the
Mhm.
box, that
Yeah.
that opens up the door for the next generation to be a little more comfortable with it, or to have a little bit more comfortable of a conversation with their child
Mhm.
about it, like you were saying. And I'm just curious, do you see progress? I think I
Mhm.
do here in Canada. I think we're getting better despite the odd setback. But what do you think, Dianna? Are we moving in the right direction?
Yeah, I think there's a lot of progress that's happening in a lot of ways. And stuff. There's a lot more resources and support and actual just like visibility for trans kids and for trans adolescents and stuff. In I know in a lot of places, trans healthcare has become much more accessible uh, for people, even in like areas that you wouldn't expect. Um, More rural, more red areas, especially in the US, there are still a lot of barriers with it, but it's becoming more normalized for people to be out as themselves, as their true authentic selves, which
Yeah,
is great.
Yeah.
couldn't
Sorry
agree
about
more.
that. Y'all are hearing me now, yeah?
Yes. Yep.
Cool. I think I unplugged my microphone because when I talk about my trans youth and some of the
Yep.
arguments that I've had to have on behalf of my clients with doctors and things like that, I get a little animated. So I think I
Yeah.
unplugged my microphone. But yeah, this is incredibly frustrating territory. Uh, do we have any meaningful outcome data around what this discrimination looks like in non-binary healthcare?
We don't have it for non-binary specifically, but we do know that the outcomes for trans people who are denied healthcare or who are unable to get it, especially among teens and stuff, can result in increased depression, increased anxiety, increased suicidal ideation. It ends up creating this like domino effect of mental health
Mm-hmm.
issues. So
Yeah.
it's yeah.
And I look forward to the day where we can actually start to calculate these numbers, but I feel like I also
Mhm.
dread it. When
Yeah.
I look at some of the statistics released by the Trevor Project, for instance,
Mhm.
as they describe the huge prevalence of queer youth suicide and these different things,
Yeah.
they're all absolutely devastating. And I guess I would just say that I recognize that this topic that we're talking about tonight can feel a little niche in certain ways. Like
Mhm.
if you're listening to this as a podcast or sitting in front of the TV and listening to this conversation and you're not non-binary,
Mhm.
healthcare is not the most
Yeah.
interesting topic. Like I can see how it can be really easy to have your eyes gloss over a little bit. But as somebody who, has spent a lot of time kind of like wrist deep in the blood of trans folks as they are trying to
Mhm.
navigate these spaces, it is just absolutely exhausting. And I'm really excited to see that we're at least having these conversations and that
Mhm.
there's some sense of hopefulness and some possibility to see some change. But before we go too much deeper with all of this, Nate, do you have any phone calls that you'd like to bring up for us?
We do have some phone calls waiting, and I just wanted to say that I think we are moving in the right direction, and I think that for the cis people that might be watching and hopefully aren't having their eyes gloss over, there are more of us out there than you might think. And
Mm,
just
Mhm.
being an advocate is going to make is going to make it easier for the person that might be on the spectrum that you don't know about to be honest with you and to have a more frank and honest relationship
Mhm.
with you. So there's a real case to be made for advocacy there.